Tungkol naman po sa Gamaleya vaccine ng Russia, ito po ang mahalagang pangyayari. Sa Setyembre, magkakaroon ng review ng Vaccine Expert Panel ng resulta ng clinical trials Phase 1 and Phase 2 na ginawa po sa Russia. Mula Oktubre naman po hanggang Marso ng susunod na taon ay magkakaroon ng clinical trial Phase 3. Simultaneous po yan sa Russia at sa Pilipinas. Sabay po itong gagawin nga po sa Russia. Ang Russia po ang magpopondo ng clinical trial na gagawin dito po sa Pilipinas. Sa Abril, inaasahang marirehistro po ang bakuna ng Russia sa Food and Drug Administration at ibig sabihin po, sa Mayo 1, 2021 pa lamang na po pwedeng magpasaksak ng bakuna galing sa Russia ang ating Presidente Rodrigo Roa Duterte. Uulitin ko po, pwede lang po, inaasahan natin na po pwede magpabakuna ang ating Presidente dito po sa Russian na bakuna sa Mayo 1, 2021. Well, masaya ko po rin mga binabalita na bukas po ang Russia sa transfer of technology para sa local manufacturing of the vaccine. Sa katunayan po, hinihikayat nila yung iba't ibang mga bansa na tumulong para mag-manufacture ng kanilang bakuna. Yung aking target date po na May 1, ito po isang ayon nga pala sa DOH. DOH at sa DOST po, Department of Science and Technology.
Hi sir, magandang hapon po. Sir, just a quick follow-up on the vaccine, Russian vaccine. You mentioned earlier na by May 2020 pa po pala pwedeng makapagpabakuna si President Duterte. So does it mean that the people should not have high hopes to have a COVID-free Christmas on December, just like what President Duterte mentioned during his last public address? Or does the President has other basis for saying that?
Well, sabihin na lang natin na ito naman pong Gamaleya vaccine is only one. No? Marami na pong mga vaccine na nasa third phase na of clinical trials. No? So baka meron naman pong mauna pa. Dahil ito pong Gamaleya, sisimulan pa lang ang third phase. No?
Mm-hmm. So there's still a chance for a COVID-free December, sir?
Pwede po. Dahil alam ko po, yung sa China, sa Oxford, at sa Amerika, nasa third phase na po sila ng clinical trial. Joseph Morong of GMA. Thank you, Yusek Rocky.
Sir, good afternoon po. Sir, first question ko sa inyo, and this is about the Russian vaccine. Yung Gamaleya, you're talking about the Sputnik, no? And then you mentioned I'm interested about the mechanics because you mentioned some clinical trials that will also involve Filipinos. Paano yung mechanics niyan, sir? Sino yung isasama natin ng mga Pilipino? And then yung pong sinabi nyo na May 2021 yung earliest time, this is really an actual commitment from the President na talagang makikita natin siya na i-vaccinate. And this is not just a metaphorical expression of support to Russia, sir.
Well, the May 1 is when the PSG may allow him, pag natapos na po lahat ng mga test na kinakailangan gawin dito sa Gamaleya vaccine. Although ang sinasabi ko nga, baka meron pang ibang mauna kasi marami na pong nasa third phase of clinical trials at matagal na po silang nasa third phase. No? So there's a possibility na mas mauna pa yung iba. As far as the President is concerned, ang tanong niya, pwede ba ako magpabakuna more than once? No? Ang sagot po initially, isa lang po siguro kasi nga titignan natin kung ano yung pinakamabisa at pinakaligtas. No? So it's not a metaphorical statement. He's willing to undergo it. Kaya lang gaya ng aking sinabi sa nakalipas, hindi naman po papayag ang PSG until and such time na nasunod po yung provision ng ating batas dito sa Pilipinas kung kailan po pwede talaga magpasaksak ng bakuna.
So yun kanina yung related question, yung mechanics, kasi sabi niyo po kanina ay may clinical trials sometime between October to March.
Yes.
And may mga Pilipino na kasama?
Well, ako po, dahil meron akong diabetes, palagi po ako sumasali sa clinical trials. Ang aking karanasan po, lahat po yan ay voluntaryo. No? So wala pong sapilitan yan. Kung sino lang gustong mag-volunteer, po pwede pong magpasaksak.
Mm-hmm. And the information, of course, is coming from officially communicated by Russia to us?
Yes, nagkaroon po ng pagpupulong sa bahagi po ng Gamaleya at ng isang komite na nandun po ang Department of Science and Technology at kung hindi po ako nagkakamali, nandun din po ang DOH.
Question from Virgil Lopez of GMA News Online for Secretary Roque. There is mounting skepticism about the effectiveness and safe Russia-made COVID-19 vaccines since clinical trials were not yet complete. Will the country's participation in the clinical trials help overcome those doubts?
Definitely po. At ang napagkasunduan naman po ng Gamaleya at ng ating DOST at DOH, magko-conduct talaga sila ng stage 3 clinical trial dito funded by the Russians. No? Pero tayo po, meron din po tayong gagawin on our own. Ito po ay separate study pa na gagawin ng DOST na popondohin din po ng DOST. Pia Renada, please.
Hello, sir. Good afternoon.
Good afternoon.
Yes, sir. Sir, first question. The president said last Monday, I will tell President Putin that I have great trust in your studies in combating COVID, and I believe that the vaccine that you have produced is really good for humanity. Sir, what impact will this presidential statement have on the review of the expert panel?
Wala naman po, no? This is conducted by scientists, no? Not politicians. So I think they will be following strict scientific protocols.
Julie Aurelio po. Question for Secretary Roque. Dr. Nina Gloriani, Chair of Philippine Vaccine Expert Panel, says priority for Phase 3 clinical trials will be given to people aged 18 to 59 and are at high risk of COVID-19 infection, including health workers and contacts of COVID-19 patients, elderly and immunocompromised people may be included later, but their participation would depend on the results of the priority group. Will President Duterte still push through with his intention to be the first to be vaccinated, even he is not among the qualified priority group for the clinical trial?
Well, yan po sinabi ni Presidente, yan naman po ay bilang pagbigay ng assurance sa taong bayan na hindi naman siya papayag na pasaksakan ng bakuna ang kanyang mga kababayan kung hindi po ito ligtas. So I don't think one person constituting an exception to instill confidence will actually violate any law. But in any case, tama ba naman po si Doktora, susundin po natin yung priorities na matagal na pong in place kapag meron na nga po tayong bakuna.